Welcome to St. Louis on the Air. I'm Don Marsh. It's become something of a tradition on this program to devote some time around Valentine's Day to the issue of heart disease. It's Heart Awareness Month. The heart is a familiar symbol of love, but a diseased organ can also kill. With me in studio to talk about diagnosis, treatment, and prevention of heart disease is Dr. Andrew Cates, cardiologist at the Washington University Heart Care Institute at Barnes-Jewish Hospital. Doctor, nice to see you again.
Thanks for having me here.
Happy Valentine's Day.
Thanks. Same to you.
Yeah. Doctor, it's about a year ago that we talked,
That's
as
right.
mentioned. What sort of progress has been made in your field that year?
We've seen a lot of new recommendations that have come out as far as how we treat heart disease and some of the recommendations for treating some of the risk factors for heart disease. I always like to start off, though, with a reminder to everybody just what we're talking about when it comes to heart disease and cardiovascular disease. When we think about cardiovascular disease, we talk about heart disease and stroke and heart failure and peripheral vascular disease. And the reason why I'm here and why this is American Heart Month is we need to do as much as we can to help raise awareness, realizing it's the leading cause of death in the U.S. 1/3 of people who die in the U.S. die from cardiovascular disease. It's about 800,000 people per year. About a quarter are from heart disease. It's more than all forms of cancer and lung disease combined. 92 million U.S. adults have some form of heart disease, so that's why we're here, and that's why we're working so hard to make improvements. And we've had changes in guidelines for treating hypertension, where we've had changes in recommendations for as we treat cholesterol. There are new advances being made in cholesterol treatment options, which we'll talk about a little bit later on, and much more being done as we help raise awareness for the importance of treating cardiovascular disease.
And it needs to be pointed out that while it can't be stopped entirely, it is preventable to a very large degree, isn't it?
That's right. And part of where we look towards prevention is, first of all, is raising awareness is key. And we come to realize there was a study that came out just last week, actually, that looked at a survey of about 1,000 men and women and asked them, just trying to get a sense of what their awareness was for heart disease, and realizing that people are grossly underaware. Many people don't know what the risk factors are, and that's, again, one of the reasons why I'm here today. Many people don't know what the risk factors are, and actually it was interesting, people are more likely to know what their bank balance was than what their blood pressure was. Mm-hmm. So that kind of gets to the fact that we need to do more to raise awareness. And there are many misperceptions out there related to blood pressure and cholesterol and hypertension.
Such as?
Well, I think many people don't realize the importance of hypertension. So we think about hypertension, and one thing we'll talk about is the new guidelines that came out just last month or about 2 months ago from the American Heart Association, American College of Cardiology, looking at how we treat and what the recommendations are for treating hypertension. And realizing that partly with these new guidelines, it changed the definition for who has hypertension. And with that, there was much concern raised that people be labeled as having high blood pressure and what that means for them. And realizing, though, by making it aware that people have hypertension really helps us target those people for treatment. And treatment doesn't necessarily need to be treatment with drugs, with pharmacologic agents, but treatment with lifestyle changes. So as we think about this, and we can take a dive into the hypertension guidelines, realizing the definition now for hypertension, normal blood pressure is less than 120 over 80, elevated is between 120 and 129. Hypertension now, stage 1 hypertension, is defined as blood pressure between 130 and 139 over 80 over 89, and stage 2 is greater than 140 over 90. And with that change, more people are now labeled as having hypertension. But importantly, with that change, a significant proportion of those people newly diagnosed now with hypertension, they're going to be targeted for lifestyle changes. And that's key in helping address this issue of hypertension, which is such an important risk factor for coronary disease and heart failure.
Most people aren't aware of what their blood pressure is unless they go to the doctors and they're having it specifically taken. That's right. They don't have devices at home, most people.
So interesting, too, and with these guidelines, what's stressed also is the importance of blood pressure evaluation, even outside the physician's office or the healthcare provider's office. So with that stress and the importance of home blood pressure monitoring, or another thing called ambulatory blood pressure monitoring. But people can get their blood pressure checked either at their local pharmacy. They can buy a blood pressure cuff, a monitor from the store. They can even go to the nearest fire station. The fire stations have blood pressure monitors or blood pressure cuffs, and they're all paramedics or EMTs and can check blood pressure there too. So there are many ways to monitor or have one's blood pressure checked. And also, again, with as our guidelines have evolved, realizing the importance of early screening for cholesterol, for blood pressure, for obesity, early education regarding smoking, all these efforts target what we call primordial prevention, preventing the risk factors that lead to cardiovascular disease.
If you have elevated blood pressure, do you feel it?
No, and thank you for asking that. That's one of the concerns, of course, is that blood pressure has taken on the moniker the silent killer. People aren't aware that they have high blood pressure many times until it's too late. And many times people make the presumption that because they don't feel it, it's not an issue. And also, one of the concerns that comes up is that people being labeled as having hypertension or needing to be on medications is that it's punishment for it. And it's not. The whole goal of treating people with hypertension is to help them long-term, to help prevent the complications that we see with hypertension.
Is hypertension likely to cause a stroke or cardiac arrest, or what's the outcome?
So hypertension causes a lot of different problems. It can lead to heart failure. It can lead to coronary disease. It can lead to stroke. It can lead to peripheral vascular disease and kidney failure. So all those conditions can result from hypertension. And again, and to come back to the issue of what we do to help treat it and address it early, lifestyle changes are key. We know about weight loss being helpful in reducing blood pressure, sodium restriction, increasing physical activity, limiting alcohol consumption. All these factors really do help reduce blood pressure. And for many people who are labeled now as having hypertension, those factors, those lifestyle changes alone may be enough to help prevent them from needing to be on drug therapy to help reduce blood pressure. So there's much that can be done for many people before they get to medications. But again, the whole purpose, we treat those numbers not just to treat numbers. Same with cholesterol. We don't treat numbers just for the sake of treating them. We treat them for the specific reason of helping reduce cardiovascular complications, cardiovascular events, death, and improve lifestyle as well.
Exercise, of course, is something that's very, very beneficial, but how much exercise is enough?
Right. So the recommendations for exercise, first, I think, first and foremost, is being active is important. When it comes to specific recommendations, which in general recommended is 75 to 90 minutes per week of moderate intensity activity, and that can be walking, it can be jogging, it can be swimming, something that in general gets one's heart rate up to typically to a specific level. But again, it's the idea of at least moderate intensity activity and at least starting.
It means that you don't necessarily have to go to a gym and pump iron
or
be a triathlete or anything like that.
No. Again, and the idea is first of all just increasing physical activity, and so many people don't have any significant physical activity that they engage in. And I take care of many patients who go out and their intentions are good, right? That they'll buy a bike, a stationary bike, or they'll buy a treadmill, and it sits there in their room or downstairs, and it's a great place to put clothes on, or they'll join a gym around New Year's and they don't use it. Honestly, I mean, walking is a great way to start. And then beyond that, though, certainly joining a gym is good, something that's going to get you motivated, but realizing buying it's a great idea, but using it's far more important.
You mentioned alcohol being a potential problem, but we also hear that having a glass or two of red wine could be beneficial.
Right. So in general, the recommendations are for people, well, first of all, for people who drink moderate alcohol consumption is key. And what's been recommended is that's usually 1 drink for women or 2 drinks for men. Just based upon body weight and some other issues. But it's not recommended that people drink just for the cardiovascular benefits. So if you drink in moderation, but we don't recommend people drink just because of the potential cardiovascular benefits. Importantly, because more time is lost, more work is lost, more healthcare issues arise from overconsumption of alcohol than I think can be attributed to the potential benefits of alcohol consumption.
Well, it is approaching, we are approaching Valentine's Day, and we also hear that chocolate, right, which will be in abundance, I think, over the next week or 10 days or so, is also good for you.
And you know, as a wise man once said, everything in moderation, including moderation, right? So there are potential benefits to dark chocolate. One must remember, though, that there are also caloric consequences to chocolate as well, too. So with that, with alcohol as well, is the importance of realizing that there may be some benefit to those foods, but realize that there are also caloric consequences as well. So not to take away all the fun, but as I say, if you're going to enjoy a glass of wine, make sure it's a good glass of wine. If you're going to enjoy good chocolate, enjoy good chocolate, but in moderation.
I'd like to open up the lines to listeners. I'm sure there are many questions out there, so we have time for calls, folks. If you want to come in at 382-8255 or 382-TALK, you can send us an email to talk@stlpublicradio.org or send us a tweet at STL on air. Let's go back to the smoking, because anytime I go to the doctors, regardless of what kind of specialty may be involved, the first question always is, do you smoke? What is it specifically about smoking that is detrimental to the heart?
Yeah. So there are long-term consequences related to smoking that are well established. Related to the addictive effects of nicotine, but then the direct effects, the carcinogenic effects of smoking. We see such a strong correlation between coronary artery disease, between development of cardiomyopathy related to smoking. The importance, as we see with smoking, though, is that we know that for patients who quit, and what I stress as I talk with patients who have coronary disease who do smoke, is the importance of smoking cessation and how beneficial it is to quit. Typically, when I see a patient who does smoke and has had an event, be it a heart attack or if they're newly diagnosed with heart failure, is that by quitting on day one, their risk of having a recurrent cardiac event related to smoking goes down dramatically by quitting. It's cut in half over the course of the first year. Then over the course of 10 years, if they stay quit from smoking, then their risk goes down to essentially someone who hasn't smoked at all. Also importantly, though, we stress when it comes to smoking cessation is the challenges that are faced with smoking cessation. And of course, it's incredibly addictive. And the importance of using help to quit smoking. First of all, being motivated is key. Secondly, utilizing pharmacologic therapy is very appropriate. We know from good studies that have been done that using a drug to help you quit smoking, if it's the patch or if it's some other pharmacologic agent, that is very beneficial in helping patients quit smoking. So it's okay to have help, and in many ways, it's really key to quitting.
We have a caller here who wants to go back to the issue of hypertension. So let's bring in Jack. He's calling from St. Louis. Jack, thanks for being with us. Go ahead.
Thanks for taking my call. Is there any examples of drug resistance for hypertension? I'll be prescribed a series of drugs, 6 months, 8 months, I'm doing fine. And then I continue the treatment, but then there goes my blood pressure back up again. Is there drug-resistant hypertension?
Sure. Jack, that's a great question. So there is an entity called treatment-resistant hypertension, and there are different definitions, but in general, the definition for treatment-resistant hypertension is somebody who's on at least 3 different medications, 3 different classes of blood pressure medications, who still have high blood pressure, or if they're on 4, and even if they have well-controlled blood pressure. And there are various reasons why people have treatment-resistant hypertension. Sometimes there are secondary causes that contribute to it, like sleep apnea. There can be also some hormonal problems that can cause treatment-resistant hypertension. Many times there are some people that just, quite frankly, have very difficult to control blood pressure, and the addition of further drugs can help lower blood pressure, but also treating different factors as well. So treating sleep apnea can help modify blood pressure. If people who are overweight, again, with weight loss, that can help reduce blood pressure. Sodium restriction, other factors that we talked a little bit earlier. But absolutely, there is a very well-known entity called treatment-resistant hypertension that's challenging. We do recommend that those people who need that many medications to help control their blood pressure be seen by a hypertension specialist, and can help with between dosing different medications differently, combinations of medications, in addition of some more advanced therapies.
Are there any early symptoms that people should be aware of that could indicate a problem?
So as far as symptoms to be aware of for heart disease, we talk about the classic symptoms for angina or chest pain symptoms, or symptoms that may be due to coronary artery disease, chest tightness or pressure, or chest pain with exertion or exertional shortness of breath. I think more importantly, though, is knowing if you're at risk as well, too. And we talk about the traditional risk factors for heart disease, if it's hypertension or diabetes, smoking, high cholesterol, if you're overweight, if you don't exercise.
Genetics.
But also, yeah, exactly, knowing family history too. So I talk about the treatable ones first, and then we talk about the ones that you can't, the modifiable ones, and ones you can't control, like genetics, like family history. And family history is important, knowing your family history. And we talk about the risk for people with a family history really being people who have early heart disease in their family. So in general, if you have somebody, a family member, if it's a male family member before age 55 or female before age 65, parent, sibling, and multiple family members affected too, that we know really does increase your risk of heart disease. So knowing if you have a family history is key, but also risk factors are so important too.
We haven't mentioned this today, but we have in the past. It surprises a lot of people to learn that women are at great risk. It's the most prominent cause of death in women. It
is, and that's something that is always important to highlight. Last Friday was National Go Red for Women Day, and reinforcing the importance of heart disease and cardiovascular disease in women. Just as you said, more women die from cardiovascular disease than most other leading causes combined. And raising awareness is so important, and that's what this is all about. Interesting too, something that just came out last week highlighted two key health issues in women: cardiovascular disease and breast cancer. It was a publication from the American Heart Association, one of the scientific papers, discussing the association of breast cancer and cardiovascular disease. So we take cardiovascular disease, which is the leading cause of death, but breast cancer, which most women identify as their main concern for dying and for healthcare problems, and realizing that breast cancer actually does increase the risk of heart disease. Certain types of chemo that women may get who have breast cancer, radiation when the heart's in the field, may result in higher risk of heart disease. But also some of the risk factors are common, be it age, poor diet, family history, physical inactivity, tobacco use, common risk factors also. So reinforcing the important link there as well, too.
Another caller it brings up a subject I wanted to get to, and that's Dave. Dave, you're on the air with the doctor. Go ahead.
Yes, thank you. Yeah, I wanted to ask Dr. Cates if he could comment a little bit about the fact that we know that heart disease is something that probably starts in childhood, even in young children. So I wanted to have him talk about that, and then maybe give us parents some suggestions about ways that we can have kids live a heart healthier lifestyle. Perhaps especially talk about diet issues, reducing sugar, and things like that.
Yeah.
Good, Dave. Thank you.
Dave, that's great. So that really is important. So you are right. I mean, we talk about heart disease being an important concern really throughout one's life. We see that in kids especially, the risk factors for heart disease really start to develop. As far as seeing heart disease, and I presume you're talking about coronary artery disease at this point, as far as seeing that manifest in kids, we don't see it all that often unless there are some really very usually genetically triggered conditions. But the building blocks for heart disease start early. So as far as childhood obesity, which can lead to hypertension and diabetes, that's an important concern. We talk about other habits that people have with physical inactivity, and certainly smoking that can start in teenagers is an important consideration also. When it comes to diet, honestly, I think what we've done too, we like to realize the importance of counseling from dietitians and nutritionists to really help kids understand just how important a balanced diet is, and understanding the association of childhood obesity with the risk of developing things like diabetes and hypertension.
Another caller, and time is running down, so I'll ask Cortland in St. Louis to be brief with this question. Peter wants to bring us back to the issue of smoking. Go ahead, Cortland.
Okay, is it just gene related that some people can smoke till they're 90 and some end up with cancer till they're 40 at 40 or 50?
Cortland, what a great question to ask, and I think this is the biggest challenge with smoking is not everybody who smokes dies from cancer or heart disease at an early age. It would make a much stronger argument to tell people to quit smoking if everybody who smoked died early. So I'm sure there's some protective effects that people have. I don't know the genetics behind that. That being said, if my advice to people who don't smoke is it's not worth taking that chance.
Thanks, sir.
Thanks.
In the time that we have left, when should a person be thinking, at what age should a person be thinking about having that regular checkup to be sure that they don't have this problem.
Yeah, honestly, evaluation starts early. We recommend that patients or individuals, even in their teens, be evaluated or screened by their pediatrician if there's any concern for especially for cholesterol problems running in the family. But certainly having your cholesterol checked in your early 20s or even late teens may be appropriate if there's concerns for family history. And having your blood pressure checked annually is important.
Annually?
So I would, yeah.
Well, it changes day to day.
So I mean, well, not for young people, but I think for certainly people as you get older.
Is there a good website that you could recommend, Doctor, for people to go and learn more about the things we've been talking about?
Yeah, so there are many websites. The American Heart Association has a good website. WebMD actually has some good information. The WashU website has some good educational information as well, too.
15, 20 seconds. What do you want people to take away from our discussion?
I think I would tell people, again, be aware of your risk factors, know your numbers. There is more. I wish we had more time to talk today. There's actually a lot of other new medications on the horizon that we'll be hearing about in the near future. We talked a little bit about obesity, and I'd love to take a deeper dive into that too. There's so much out there related to obesity and the way we can treat with lifestyle changes to help reduce overall cardiovascular risk.
Well, folks can go online, at least get started on that. We'll have you back again. What a year this time.
I know.
Andrew Cates,
Great.
Thank you.
Thanks for having me again. Always a pleasure.
Here. Archive versions of past St. Louis On the Air programs available for download or podcast at stlpublicradio.org/STL On Air. St. Louis On the Air is a production of St. Louis Public Radio, 90.7 KWMU. Thank you for listening. I'm Don Marsh.
Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.